There's this phrase you sometimes hear, doggy dementia, which is an everyday term for cognitive dysfunction syndrome in dogs. But what does it really mean, and how is dementia in dogs diagnosed? And can it be prevented or treated? To find out more about dementia in dogs, I'm very pleased to welcome board-certified neurologist Stephen Hansen, who runs the Veterinary Neurology Center in Palm Desert, California. Welcome to the program, Dr. Hansen.
Hi, thanks for having me.
So, Stephen, doggy dementia, this is a real entity, different from just a dog getting older, correct?
Right. It's not really a normal aging change. It's more consistent with like Alzheimer's in people. There are a lot of similarities between the two conditions.
And how common is it?
Well, some estimates say about 50% of dogs over the age of 11 can show some signs of cognitive dysfunction syndrome. And then once a dog reaches 15 to 16 years old, the percentage of incidence goes up to about 68%. So a fair number of dogs that get to that age will show some symptoms of cognitive dysfunction.
And what are the symptoms? And especially, what are the early symptoms we can look out for?
Yeah, the early symptoms can be kind of hard to detect because, sometimes it's hard to tell if a dog is really disoriented or not. Definitely when it becomes more advanced, you'll see things like a dog getting lost in the house or not recognizing people they normally would recognize. Oftentimes, they also have disruption of their sleep-wake cycle. So they may sleep all day and then be up wandering aimlessly around the house at night. Sometimes they'll lose house training. And then occasionally a dog with dementia will have some anxiety and be a little bit agitated. It can start as early as about 7 years of age, although with most dogs it starts much later.
Stephen, are there other degenerative diseases that cause cognitive decline in younger dogs?
Well, just about anything that affects the brain can create symptoms that mimic cognitive dysfunction. So things like a brain tumor, an infection in the brain, immune disease in the brain, those can cause disorientation, behavioral changes that can look like cognitive dysfunction. But definitely, if a dog younger than 7 were to show symptoms like that, we would really want to do some tests to rule out other things.
And how about aggression? Can that develop?
It's unlikely that cognitive dysfunction syndrome is going to turn a placid dog into an aggressive dog. However, they can be more easily startled, and oftentimes dogs with cognitive dysfunction also are losing their hearing, maybe their vision isn't the best, and so they can be startled, and they may be a little more prone to snaps. So I think that some caution has to be exercised around a dog like that. But it's unlikely that they're going to start aggressively, going after people.
How do you diagnose the condition?
It's mainly diagnosed off of the history, having symptoms consistent with cognitive dysfunction. But a really important part of diagnosing it is to rule out other things that can cause similar problems or similar symptoms. So a good examination by a veterinarian is really important, and maybe also some lab work, because other diseases like liver dysfunction can make a dog disoriented. Sometimes dogs with eye problems can have visual deficits where they look disoriented. And then also dogs with painful conditions like degenerative joint disease, they may be more reclusive and less interactive with people. So if an underlying disease like that can be identified and treated, maybe the dog can be restored back to a normal level of function and be a happy pet again. If medical conditions are ruled out, then it really takes an MRI to diagnose canine cognitive dysfunction, because like I mentioned, things like a brain tumor can really mimic the symptoms of cognitive dysfunction. So that might be treated with a variety of means. And there are things that we can see on an MRI that would be very indicative of the brain degeneration that we see with cognitive dysfunction syndrome.
Are there breeds of dogs more susceptible to getting doggy dementia?
There's really no breed predisposition. It can happen in small dogs and large dogs. Both sexes are affected, so there's no way to select for a dog to avoid cognitive dysfunction.
And no research showing mixed breeds might be less likely to get it?
No, because it's not fully understood how the disease develops. There are certain parts of the pathophysiology that have been worked out, like there's free radical production, and there's deposition of a neurotoxic protein called beta amyloid. But we don't really understand why some dogs develop beta amyloid more quickly than others. There may be some sort of genetic predisposition, but at this point we don't really know. And
Stephen, describe how this disease progresses. The end stages of dementia in people are pretty horrible.
Yeah, unfortunately, it can be pretty sad as the dog really loses interaction with the family. They may spend more time sleeping, and eventually they may stop eating and drinking. So that can produce all sorts of other serious symptoms.
Discuss treatment of dementia in dogs.
Yeah. There are basically three things that can be done to address dementia and slow its progression. Unfortunately, there's nothing to be done to cure it, but it can be slowed. And one of the ways that can be done is just with environmental enrichment. So, new toys, regular exercise, a lot of interaction, that sort of thing can improve the mental function. So a dog that really has no stimulation is more likely to have more rapidly progressive dementia. Then there's some nutritional things that can be done. Certain supplements like antioxidants, omega-3 fatty acids, ginkgo biloba has been looked at. Those things might slow the progression. And in fact, there are a couple of food companies that have made special diets, like there's Hill's BD, which has these sort of antioxidants in it that may slow the progression of dementia.
And these things...
And then the third...
Yeah, go ahead, please.
The third way is with medication. Unfortunately, there really is no medication that is consistently effective. There's a medication called Anapril, also known as selegiline or L-Deprenyl, and that's been approved for use in dogs to treat cognitive dysfunction. In testing of that drug, about 69% of dogs treated with it showed some improvement in their mental function. Interestingly, the placebo group in that study had about a 52% improvement just with the placebo. So it's hard to know for sure how much that drug works. The other thing that we know Anapril does is it causes more stimulation. Both Anapril and its metabolites, which are amphetamine and methamphetamine, can just cause more arousal. So sometimes those dogs may be alert, they may be more active. Doesn't necessarily mean they're having better mental function.
Dr. Hansen, is there any evidence that dementia in dogs can be prevented or delayed in any way by enriching the lives or diets of dogs, like the things that you mentioned that could slow the progression of the disease? Is there anything we can do to prevent the disease?
Yeah, I think intuitively, based on what we know about the pathology, things like enrichment, good healthy diets, all-around vitamin supplements, those things make a lot of sense. I don't think there have been any long-term studies to look at dogs who had substandard diets compared to dogs with good diets and how that changed the outcome and increased prevalence of dementia. But I think that it makes sense that having a lot of interaction, an active lifestyle, a lot of engagement with people and other animals is healthy for a dog's mental function its whole life.
Dr. Stephen Hansen, thank you for appearing on Animals Today.
Oh, my pleasure. Thanks for having me.